Hello, today I will discuss about the histology of the urinary bladder. The urinary bladder histology identification, we have 4 points. Number one, the mucosa with urothelium. This is the mucosa with urothelium, and this is the lamina propria. So mucosa has two parts. One is the lining epithelium, that is called urothelium, also called transitional epithelium. This is the loose connective tissue, the lamina propria. We have very thin submucosa, and we have muscle layer. Muscles are arranged haphazardly. They are little bit more arranged near the neck of the bladder. Here we have the inner muscle layer, we have the middle muscle layer, outer muscle layer. They are intervened by the collagen bundles. Outside that, we have the Adventitia. Adventitia, because this section has been taken from the urinary bladder near the neck of the bladder, near the urethra. But if we take the urinary bladder section from the upper aspect of the urinary bladder, we will get the peritoneum, that is called serosa. So it may be adventitia, maybe serosa. Adventitia in this region, urinary bladder in the neck of the bladder, but the superior surface of the bladder that forms the vesico-uterine pouch or vesicorectal pouch, that surface is lined by epithelium of the peritoneum, that is the mesothelium, that is the serosa. So adventitia is here, but we may also get serosa. When the bladder is empty, the mucosa is highly folded and the urothelium has bulbous umbrella cells. These are the bulbous umbrella cells, the superficial cells. These cells may be binucleated, usually one nucleus, but it may contain two nucleuses. They actually covers the underlying cells. Though the folds disappear when the bladder is distended, there is no fold in the trigon area of the urinary bladder. What is trigon? The trigon is the area inside the urinary bladder where the mucus is very smooth. It is a triangular area that is bounded by the opening of two ureter and the urethra. So that is the trigon area. In the trigon area, there is no folding. The mucus is very much smooth. The epithelium of the urinary bladder is called transitional epithelium, that is present in the urinary system, extending from the minor calyces, actually from the end of the collecting duct to the renal papilla, and continue through the renal pelvis, the ureter, the urinary bladder up to the prostatic part of the urethra at the level of the opening of the ejaculatory duct in male, in female up to the urogenital membrane. So almost entire urinary tract have the transitional epithelium lining. We call it urothelium. It has dome-shaped superficial cell. Those cells may be binucleated in places. Plaques and interplaque spaces in the cell layer. In the apical cell layer, we have plaque that is formed of glycoprotein. And we have also interplaque spaces between the plaque. And between the cell, we have the desmosomes or the macular adherens and also tight junctions. This plaque and interplaque space is responsible for osmotic barrier. So urine may not be absorbed through the lamina propria because of the plaque and interplaque space. So it prevents reabsorption of the content of the cavity, the urinary bladder lumen. So this is the transitional epithelium. This is a superficial cell layer. They are dome shaped. They're also called umbrella cell. Underneath that, we'll get some pear-shaped cell. We have multiple pear-shaped cell. Then this is the basal cell. They rest on the basement membrane. Okay. So this is the transitional epithelium. We have multi-layered epithelium. The epithelium layer may be changed depending on the distension of the urinary bladder. If the urinary bladder is distended, containing urine, in that condition, the layer of the bladder will be decreased. Okay, because of the sliding of cell one over another, but they don't lose their integrity because they are connected by the macular adherens or desmosomes. Then underneath the transition epithelium, we have the lamina propria, that is loose connective tissue. It is rich in blood vessels. We are looking blood vessels. We have also some lymphocyte in the lamina propria. Okay. Here, the changes in the apical epithelial cell or dome-shaped cell on the luminal surface with the plaque and interplaque region. The plaque and interplaque region. This region may hinge inside the cell and may hinge out like this. It is going down here. Okay. So they are connected by the cytoplasmic filaments. So these are the osmotic barriers. So content in the urinary bladder will not go inside the cell, will not go to the lamina propria. We have also intercellular junction and the occluding or the tight junctions. When the bladder is full, the mucosa is pulled smooth and the urothelium is thinner and the umbrella cells are flatter. Okay, excuse me. The lamina propria has no gland. You have to remember that. This is the lamina propria. It is vascular, but it has no gland. Exception? Yes. Near the urethral opening, we will get some mucous gland. Otherwise, there is no gland. The smooth muscles of the bladder wall forms the detrusor muscle. We'll get detrusor muscle here. They are not regularly arranged, they are haphazardly arranged. We have collagen bundle between them. Okay, so we have some clinical applications. Cystitis. What is cystitis? That is the inflammation of the urinary bladder. It is more common in female because of they have short urethra. Metaplastic changes in the urothelium that is possible due to chronic irritation or chronic cystitis. One type of epithelium may be converted into another type of epithelium. So the transitional epithelium may be converted into keratinized stratified squamous epithelium. There may be some irritating stone or maybe an infection inside the bladder that may change the epithelium type. Transitional cell carcinoma is one of the common cancer that happen in the transitional epithelial cells. Okay, so we have to summarize and wrap up our discussion. What are the identifying points for the slide of the urinary bladder? Our answer should be mucosa, that is composed of transitional epithelium, also called urothelium. Then we have the epithelium that rests on basement membrane. Then we have the lamina propria. Then we have very thin layer of submucosa. We have muscle layer. Muscle layers are not regularly arranged. We have bundles of collagen fibers between the muscle layer. We have inner muscle layer, middle muscle layer, outer muscle layer. They all are smooth muscle. They are called detrusor muscle. Okay, they are called detrusor muscle. What are the characteristics of transitional epithelium? Transitional epithelium, the superficial cells are called umbrella cells. They are dome shaped. They cover the underlying cells, and they have changes in the cell membrane. It contains the plaque and interplaque space. That is, the plaque is composed of the glycoprotein, and around the cell membrane of the superficial cell, we have also glycocalyx there, and intercellular junctions are present, like that of desmosomes and also occluding junctions. So, transitional epithelium, when the urinary bladder is distended, lining epithelium layer will be decreased to 3 layers. Okay, when it is relaxed, lining epithelium layer will be 5 to 6 layers. What is the osmotic barrier in the transitional epithelium? On the apical surface, we have plaque. These plaques are composed of glycoprotein. We have interplaque space. They may push in as a hinge inside the cell. Okay, so we'll get this plaque that will form the osmotic barrier. Plus, we have also the occluding junction between the cell and also the macular adherens of desmosomes. Muscle. What is trigon? Trigon is an area smooth mucosa inside the lumen of the bladder that is bounded by the two ureter on each side and the internal urethral opening on the other side. This triangular area inside the urinary bladder is called trigon, and the mucosa is very smooth. There is no folding of the mucosa over the trigon. What intercellular junctions are present in the transitional epithelium? These are the this is the these are the desmosomes or macular adherens, and most likely we also get the tight junctions or junular occludens. So the desmosomes or macular adherens and junular occludens. So we got that. The clinical application. This is the lamina propria, transition epithelium. This is the muscle layer. We got that. And these are the osmotic barrier, plaque, interplaque space on the apical surface of the dome cells or the umbrella cells, the apical cells. This is the transition epithelium. This is the dome cell. It has large nucleus, one nucleus. It may be binucleated. Okay. These are the pear-shaped cell, piriform cell. Then these are the basal cell. They are cuboidal or low columnar cell on the basement membrane. Lamina propria, rich in blood vessel, and also contains some lymphocytes. Okay, transitional epithelium. We got that. This is the folding present when the bladder is relaxed. Okay, but it is absent in the trigon area. Okay, these are the muscle, inner muscle, middle muscle, outer muscle layer, small thin submucosa, lamina propria, transition epithelium. And that's all about the histology of the urinary bladder. So if you like my video, please support my channel. Please subscribe me, share the information with your friends, and have a nice day. Bye now.